You know, oftentimes after a tragedy or an accident, particularly if it's one that could have been avoided, then people are quick to say, well, I didn't know, or I wish I knew. But then it's kind of too late because it's after the fact. And it's particularly true for certain things that happen during the summer. You know, during the summer it's hot, and you know, during the summer people like to recreate and go out to the lake and get on their boats. And also during the summer, you know, young people can't wait until the pool opens. But there is a cadre of information that is necessary for individuals to know so they can be safe in that pool endeavor, in that out on the lake and on the boat in endeavor, and in trying to get out and do some other activities in the heat. So today, I'm happy to be able to provide some important information as it relates to summer safety. And I have none other than a real expert on summer safety in the person of Dr. Alicia Register, and she's going to talk to us about safety in all of those areas. But first of all, we're going to ask her to talk to us about herself.
I'm Alicia Register. I'm one of the surgery residents at the Medical Center Navicent Health. I grew up in Fayetteville, Georgia, only about an hour north of here. Knew I wanted to be a doctor my whole life. I watched too many reruns of MASH and ER, so I thought that's what all doctors did. And now that I am one, and I'm training to be a surgeon, I see that actually a very small minority of doctors actually want to do that kind of, and I'm one of those crazy ones that do. So I enjoy trauma and general surgery, and that's what I hope to do when I graduate 2 years from now.
Outstanding. And I heard you mention that you really got an affinity for smaller communities and
Yes, sir.
want to.
Yes, sir. So I really have seen in my training, there's we're very blessed in Macon. We have Navicent here, and it's a trauma center, and so we have really great access to a lot of different specialties. But you go even an hour south of here, and you don't have access to that kind of care. And when you live in a small town, there might be one small hospital in that whole county, maybe a handful of ambulances to cover the whole area. It's really difficult to get to that care in a timely manner. So if I can, over my career, help improve that, that's really what I would like to focus on.
That's very, very, very noble. So let's talk about heat safety first. You know, I mean, what are some of the precautions that, I mean, and this, somebody said it was over 100 today. I don't know whether it's true or not.
That might be right.
But it's hot.
Yes, sir.
You know, and there are some precautions that, you know, one should take as it relates to heat. A lot of people take it for granted. You know, they go out and they exercise and play and run, not realizing biologically, if you please, how that heat can affect us. Talk about that for a minute.
Sure, that's exactly right. So in Georgia, we not only have hot summers, we have humid summers as well. And that humidity really takes an effect on your body more so than just the heat. The way your body releases heat is through sweating. Your sweat on your skin evaporates, and that releases some of the heat energy in your body. That's how you cool down and maintain your body's temperature. If it's humid outside, the sweat takes longer to evaporate, and so it actually is more difficult for your body to cool down in more humid conditions. So
let me ask you this. I always acted as if I understood when the weatherman said humidity. I mean, what does that mean?
So it's the percentage of water that's in the atmosphere,
okay.
and it. I'm certainly not an expert on weather patterns, but it has to do with kind of the pressure above like around the clouds in our atmosphere, and it keeps the water in the air rather than being able to evaporate or concentrate into clouds. So literally there's just more water molecules in the air that you're breathing, and that's on your skin, and so it really does make it difficult for your sweat to be able to evaporate off your skin because of the pressure of the water in the air.
Well, I'll tell your instructor you get an A.
Okay.
Oh, you're not majoring in weather.
No, I'm not. Certainly not.
Well, what are some of the other precautions as it relates to the heat, for individuals, who are out walking or just in a house, without air conditioning?
Sure.
What should one do, in order to try to, and what is a heat stroke, first of all?
Right, okay, so you asked a lot of good questions, so I'll start off
all at
with,
once,
so you made a good point about air conditioning. A lack of air conditioning is actually the #1 risk factor for related injury. So if one does not have air conditioning in their house, they can go to a public place that does have air conditioning, like a mall or library or anywhere like that, so you can try to be in the air conditioning in the hottest parts of the day. So to go along with, if you are exposed to overheating, so what happens when your body overheats is when your body reaches an internal temperature greater than 103 degrees Fahrenheit. So a normal body temperature is 98.6. Most of the time when people get over 100 degrees Fahrenheit is when we start considering it a fever that you need to worry about and be treated for. 103 degrees Fahrenheit is where you would enter the point of heat exhaustion, and your body's chemical mechanisms actually have difficulty then controlling your temperature. So once you get over 103 degrees Fahrenheit, it's more difficult for your body to cool down, so you actually continue to get hotter and hotter more quickly. So if you notice a family member or a neighbor, and I do want to point out that the elderly, so greater than 65, and young children are most at risk. So if you have an elderly neighbor or family member, call them and check on them a couple times during the day. Make sure that they're okay. If you do find someone that is confused, if they're still sweating, then they're not having a heat stroke. So I'll talk about the difference between heat exhaustion and heat stroke. There's two different kind of classifications. So the first and kind of more mild form is when you might be confused, you might still be sweating, you might have a weak pulse, a rapid but weak pulse, and that's heat exhaustion if you're still able to sweat. Best thing to do for a person like that is cool them down, put ice packs. If they're alert enough, they're not confused, and they can drink and swallow safely, have them drink cold water or Gatorade or Powerade or anything of those kind of electrolyte drinks. If somebody is beyond that point, their skin is hot and dry, they're not sweating anymore, they're nauseous and vomiting, they're confused to the point where you wonder if they'd be safe to even swallow water, call 911. The quickest thing you can do, and while you're waiting on the ambulance to come, cool them off as much as you can. Put them in a cold tub, but try to find any way possible to cool them down. So that would be my best advice, is check on your neighbors or your family members. If you do find somebody that you're concerned about, cool them down as quick as you can. And if you're worried at all, call 911, because our EMS crews are more than happy to, they'd rather get a false alarm than somebody that waited because they weren't sure.
Right. So now, with a heat stroke, a person can really pass out or something like that?
Yes, sir. That's that, and then at that point they're unable to help themselves, and there are actually I think 209 deaths from heat-related injuries in 2011. So in 2011, 209 people actually died from heat.
Wow.
Right, that's impressive. You think 209 people, that's a lot of people, and that's just in the U.S. alone.
Yeah.
So.
And the thing about it, Doc, is that it's getting hotter. Look, it seems to be getting hotter every year. So
Yes, sir.
I think to impart this kind of information is very, very important to the community, and it kind of helps us to understand, the difference between exhaustion and stroke and what to do. So, that's another A for you today, and we'll move right along to water safety.
Sure.
Both from a pool and, every year, unfortunately, we'll hear some kid drowning. And it's not always in a pool. Sometimes they find swimming holes and things of that nature. So talk a little bit about that, if you would.
Sure.
This is a call to action.
A call to action.
I'm your host, Alex HABERSHAM, all engrossed in this heat stroke conversation. But there's a need for me to reintroduce my host today. It's Dr. Alicia Register of Navicent Health, who aspires to be a surgeon, a trauma surgeon, hopefully in smaller areas that I want to congratulate her on. And we're talking about heat and summer safety and water safety. So we're going to take a break and we'll be right back. I'm so excited. I'm excited because we have launched a new and improved website at www.maconblackpages.com. Why do you say improved, Alex? Well, I'll tell you why, Alex. Because it's got news, it's got events. If you got an event that's going on in the community, you can send it to us at publisher@maconblackpages.com, and we'll put it in our event section. And most importantly, it has the listings of African American businesses throughout Central Georgia. If you're one of those, you need to go to the website. You can even submit your own listing now. The phone number is 478-464-0074. www.maconblackpages.com. We're back. I'm Alex HABERSHAM, your host of A Call to Action, interviewing Dr. Alicia Register, who's doing her residency at Navicent Health in surgery, mind you. But she has agreed to come and talk to us about summer safety, part of which deals with heat exhaustion, heat strokes. But, in the summer, people love water also. So we want to talk a bit about water safety. And let's begin with people safety in water. Not boats, but people. Like kids and adults and things of that nature. So what are some of the factors that, one should be familiar with as it relates to water safety?
Sure. Well, I think one thing that we kind of tend to overlook is, understand if you're a comfortable swimmer or not. There's a big difference in swimming in a pool where there's no current versus a lake where there are wakes because of boats that have gone by and things of that nature. Rivers, even more so, they have currents, and oceans are probably the most dangerous, so when you're going to the beach and everything, keep that in mind, that even if you can swim well in a calm pool, it might be different than swimming in an ocean. So another thing is, yes, there may be a lifeguard on duty, but that doesn't mean that they're watching your child or you at all times. They've got to keep their eyes on a lot of different things. So if your child is in the pool, please don't assume that since a lifeguard's there that it's safe to leave them unattended. So in regards to, we're lucky enough to have Lake Tobesofkee and Lake Sinclair and places like that close by. And I know Lake Tobesofkee has our water park and everything, and that's great. It's a wonderful thing to have access to in the summer. But do keep in mind that the lake is, it can be dangerous, with boats coming by. And like I said, the wakes are different. It's not the same as swimming in a calm pool. So I just keep that in mind, when you take your kids there.
Okay, what about, I can't remember the name of the malady, but you remember the lady who cut herself and was in the water and had to have her
Oh, you're
had
talking
to
about
have her
infection?
Your limbs amputated. Is that one of the caveats of going in the water anywhere, particularly in lakes and rivers and things of that nature?
I would certainly be mindful if you do have a cut on your skin or anything of that nature. I probably would avoid dirty water like that. Even a pool, yes, it has its cleaning solutions in it, whether it be chlorine or saltwater pools like they have nowadays. I think you're at less risk in that, but I certainly would never guarantee you would never get an infection from that. But certainly if you've got an open wound, I would avoid a lake or a river or an ocean or any kind of body of water that has animals living in it like fish or plants growing at the bottom. There's so many bacteria that grow on those that might not be harmful if your skin is intact, but if it touches your tissue inside, which is not used to. Oh yes, sir. Even and the worst would be if it got in your bloodstream. So definitely, if you're concerned about a wound, I think signs to look for would be good to know if you're concerned if a wound's infected or not. If it's red around the site, if it's very tender to touch, very painful to touch, it feels warm. And certainly if there's any kind of drainage coming from the wound, then those are all signs that it could possibly be infected. And I would go to one of the local urgent care centers or the ER to have it seen about. If you get it diagnosed soon enough, you might just be able to take care of it with antibiotics. But the worst possible scenario would be if you didn't get it seen about and you did unfortunately get to the point where the infection was so bad you had to have...
Like this lady.
Right, if you had to go to the OR and get it debrided or worst case scenario amputated. Yes, sir. And we see that very commonly, especially if you have medical problems inhibiting wound healing like diabetes or poor vascular disease, bad blood flow. Then those patients are most at risk for poor wound healing and having to get a wound surgically debrided rather than just taken care of with antibiotics.
Thank you. We're going to take another break right quick, and we're going to talk some about boating safety. This is a call to action.
A call to action.
Alex HABERSHAM here interviewing Dr. Alicia Register of Navicent Health. We'll be right back. We're back, engaged in a very, very interesting and informative conversation with Dr. Alicia Register, talking about some of safety and trying to impart very important education information on keeping everybody safe. And because I can think of an old cliche, it's better to be safe than sorry. So we're trying to keep individuals from being sorry as it relates to some of the happenings during the summer. And one thing we did not mention, although we talked about heat stroke and heat exhaustion, is the importance of staying hydrated.
That's very true. So in these summer months when it gets so hot and humid outside, it's very important to not wait till you're thirsty to drink water or an electrolyte replacement drink. You want to drink on average 2 to 4 glasses when you're going to be, 2 to 4 glasses of water or one of those drinks when you're outside. Try to avoid alcoholic beverages and really sugary drinks. I know we love sweet tea. I love sweet tea. But sweet tea and really sugary drinks actually make you have to go to the bathroom sooner. It actually concentrates your blood with all the sugar in it, and you actually have to urinate more frequently when you drink those when you're outside. So if you're going to be outside doing activities, try to drink water or some kind of electrolyte replacement drink.
Now when you say electrolyte replacement, you're talking about like Gatorade,
Right, like a Gatorade or Powerade, something like
something
that.
of that
Right.
nature. Okay, thank you very much. Well, what about sunburn? You know, we didn't talk about, you know, being in the sun, and I guess, you know, I mean, and I think, you know, some African Americans think that they can't get sunburned, but she's laughing.
I can tell you, I get sunburned a lot. No,
I do too. But talk a little bit about it, and is it more likely among, you know, is there a difference from an ethnicity perspective as it relates to being sunburned? I know, well, I mean, I know, we all know that, you know, that African Americans are from Africa and we're dark, and Europeans are from another and they are lighter, but what's that connection of that relationship?
Right. So, you know, what makes skin dark or light is how much melatonin is in your skin, and it is a protective factor against sunburns and skin cancers and things like that. But certainly African Americans or people with tan skin certainly can get sunburnt. I would not assume that, I have naturally tan skin or I'm African American, I can't get sunburnt. Certainly use sunscreen. If you're going to be outside, anything with an SPF higher than 15 is good. I would probably use something stronger on your face, as that tends to get more exposure. Don't forget about your ears. They get burnt too. And look for sunscreens that say broad spectrum, or UVA and UVB, the two different kind of ultraviolet rays that cause sunburn, and with too much exposure could potentially over years cause skin cancer.
Right. I don't want to get too biological here, but so you would think that African American skin has more melatonin than, you know, say European.
Right. So that's what pigments skin. So it makes it the color
dark.
of the skin. Mm-hmm.
Yeah.
Yes,
Okay.
sir.
Well, thank you for that information. But regardless of what your color is, your shade of color, if you please, one should still put on, you know, sun protectant.
Certainly.
Yeah, okay.
And another thing is with kids. So don't forget to put the sunscreen on your kids too. And if you're going to do a waterproof or a sport-proof kind of sunscreen, apply it 30 minutes before they actually go outside or get wet. You can't apply it and then jump in the pool.
Right.
So it takes about 30 minutes for it to really set in. So I would apply it before you get in the car to go to the pool. So.
Yeah. What about boating safety?
Sure. So that, you know, a lot of people are going to take their boats out to the lakes and the rivers. Certainly don't be drinking and driving just as if it's a car. It's anything with a motor. So don't drink and drive a boat. You also want to make sure you have enough life vests for everyone on the boat. I think that's even a state law, is if you get pulled over by the DNR on their boat, they're going to check how many life vests you have. And if you don't have the same amount as the people on the boat, you'll get in trouble for that.
Right.
Another thing from personal experience is if you're in a canoe or a kayak, you still need to wear a life jacket. I know that people might not think of it that way, but you probably are at more risk because you're smaller, and boats that are bigger, that are creating wakes, you're not going to be able to counteract that as much. You're in a smaller boat. So
Now, do you kayak or you canoe?
I used to have a kayak.
Okay.
I didn't have time for it anymore, so I sold that. So I gave it to somebody that had time for it. So.
Okay. Well, it's very, very interesting. And, you know, speaking of kids, I mean, I understand that Navicent now has a pediatric emergency room. And I guess, you know, and I'm not a doctor, you know, and didn't want to be one when I was a child either, didn't know that I could. But I guess it takes a different kind of care and a different kind of treatment for young people and children than normal. So if in fact there's a problem with a child, with heat stroke or almost drowned or any kind of summer or any kind of accident, frankly, or any kind of sickness, then it's important for us to realize that if a child is sick or an infant or what have you, then there is a pediatric emergency room available through Navicent.
Yes, sir. So what we've started doing is, instead of having our regular ER physicians who actually, so you can go through special training as an ER physician to be qualified to see pediatric patients, and a lot of our ER doctors do have that training. But what we're lucky enough to have now is actual separate wing of the ER where we have pediatricians who then have extra ER experience.
Wow.
And so it really does change, the background of your training really does change the way you think and how well you are comfortable taking care of a child. It's been a really positive effect on, I can only speak from the surgery standpoint, but when we see a child with a surgical issue, I really do appreciate having the pediatrician who's trained in the ER.
Right.
The other thing to remember is with kids, they compensate very well, but that means that when they get sick, they cover it up really well until they really get sick.
Right.
And it changes very quickly. So if you're worried your child's sick, the safest thing is take them to see the doctor. If you're not sure, take them to see the doctor, because when a child gets sick, they can cover it up very easily, and then they get to a point where they get very sick very quickly.
Serious.
So it's good to go to a place where they're specifically trained and qualified to identify those risk factors.
Wow. This is a call to action.
A call to action.
I'm your host, Alex HABERSHAM, having interviewed Dr. Alicia Register, who has imparted very, very important and significant information on summer safety, summer health, pediatric emergency room boarding, and a lot of other things, and we really appreciate it. Thanks for sharing. And the only thing that Dr. Register and I can tell you is to be safe out there. Have a great day.
www.makingblackpages.com